Hello and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class healthcare provided at each of our Regional Health Command Atlantic medical facilities to soldiers, their families, retirees, and other beneficiaries. Our location this month is the National Infantry Museum at Fort Benning, Georgia. Fort Benning is the home of infantry armor and the U.S. Army Maneuver Center of Excellence. This is where soldiers prepare to win in a complex world. But you can't win if you aren't ready to deploy. Fort Benning is also home of Martin Army Community Hospital, the newest medical facility in the Army's health inventory. At Martin, the focus is squarely on readiness. First, we visit a place every soldier who arrives at or deploys from Fort Benning receives a health assessment, the Readiness One-Stop.
Every active duty and reserve component soldier's health readiness, including HIV screening, immunizations, DNA collection, hearing conservation, all elements of medical readiness and deployability are tracked through the Medical Protection System, or MedPros.
We review their MedPros data as they come into Fort Benning. We take that information as the soldier comes here, then we'll end up updating that information as far as immunizations or any blood draws that may need to happen, like HIV. Hearing is in the same building as us, so we do hearing, their PHAs, or if they came from a recent deployment, their post-deployment health assessment or reassessments, we'll do those as well. But
the mission of the Medical One-Stop doesn't end with the newly arrived or deploying soldiers. The Medical One-Stop also serves Fort Benning's permanent party soldiers as an alternative treatment facility to the post-troop medical clinics. The result here and at other posts across the Army is a force that is medically ready when called.
We do not have a ready fighting force, then we cannot protect the United States of America. We have to ensure that the soldiers that are here, especially in the time right now where we're getting smaller, that these soldiers in a moment's notice can leave and defend the United States of America.
For the Regional Health Report, I'm Craig Coleman.
Many leaders are grown here at Fort Benning. From the NCO Academy to Basic Officer Leader Course, the next generation of Army medicine leaders is in training here at Martin's Family Practice Residency Program. It's the oldest in the Army, established in 1972. Residents learn the skills necessary to save lives on the battlefield, keep soldiers ready for deployment, and care for family members and other beneficiaries back home.
Every Tuesday afternoon, Martin Army Community Hospital family practice residents and medical students on rotation here undergo musculoskeletal training. The emphasis is on examinations. The subjects are each other. Dr. Clark Cobb leads the training.
Having been in the military, having been deployed, it was obvious to me early on that you need a lot of musculoskeletal practice when you get to a position where you're taking care of a lot of soldiers. Many of the things that happen when people are deployed and downrange that affect readiness have to do with their musculoskeletal system. And as family physicians, we are trained to treat lots of different conditions, but one area I thought was fairly weak, for me at least, was this aspect of primary care. So helping residents and students learn about this early in their training sometimes prepares them better for their roles down their career path a bit, where they'll be either in clinics or in a deployed setting and can take care of folks with complaints of their joints and back and things.
The medical residents and students also practice immunization techniques using medical models in Martin's Simulation Center. Dr. Cobb sees a difference between these newest military physicians and the doctors of his generation.
Technology is the obvious game changer. There is a lot of familiarity with technology, which in many ways can be a great benefit to the treatment protocols that we use and certainly enhance diagnoses. Younger folks are a lot more facile with that than certainly me and I'm sure my peer group would be. Seeing the Army kind of evolve over the last 20 years, both in wartime situations and peacetime situations.
For the Regional Health Report, I'm Jerome Banks.
Martin sponsors several educational and training opportunities designed to grow leaders, including medical coding classes in partnership with Columbus Technical College and nursing assistant training with the American Red Cross. And that's the Regional Health Report for March. Thanks to the National Infantry Museum and Martin Army Community Hospital for hosting us. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Thanks for joining us.